Hello and welcome to our webinar, Language Assessment Strategies for Culturally and Linguistically Diverse Children. Our presenter today is Dr. Teresa Girolamo. Dr. Girolamo is a past doctoral fellow at the University of Connecticut and incoming assistant professor in the School of Speech, Language, and Hearing Services at San Diego State University. Her research involves language acquisition in individuals with language impairment, particularly in autistic, Black, Indigenous, and other people of color, adolescents and young adults and non-autistic individuals with developmental language disorder, as well as efficacious strategies for language assessment. We also have Nancy Castilleja, our Pearson Senior Product Manager, Patricia Ibarra, our Pearson Senior Research Director in Speech and Language, and Darlene Davis, our Pearson Senior Operations Training Administrator with us today, and they will monitor the Q&A for Dr. Girolamo. Oh, I do apologize. Girolamo. We have Sean Whitley and Jennifer Stoker with us today also, and they will provide ASL interpretation for today's webinar. This webinar is being presented in broadcast audio. Please turn up your computer speakers as there are no dial-in options. We are also presenting with closed caption. To initiate closed caption on your computer screen, please click on the box marked CC, click on Live Transcript, and Show Subtitle. The webinar handout link is in the chat box. Please download this document during the live presentation. Please type your questions, concerns, and comments into the Zoom Q&A. We will answer questions time permitting. If your question is not answered during the live event, or you have a specific product question, please email your questions to clinicaltraining@pearson.com, and we'll also put that in the chat box. Webinar certificates of attendance will be automatically emailed to you within 3 weeks. With all that being said, I will turn it over to Dr. Girolamo. I do apologize.
No worries. Thank you so much for having me. As you heard in the introduction, my name is Teresa Girolamo, and I'm going to talk with you today about language assessment strategies for culturally and linguistically diverse children. And from now on, instead of saying the entire phrase culturally and linguistically diverse or diversity, I will just say diverse or diversity. Here is an overview of what I will talk about today. First, I'll share a little bit about myself and my positionality to this topic. Next, I'll talk about what motivates the need for quality language assessment strategies to support diverse children. Then I'll provide a walkthrough of an approach to language assessment for diverse children, and we will apply this to 2 case studies. Finally, I'll share some concluding thoughts, and hopefully we will have time for discussion. At least when I practiced this talk, there was time left over for discussion. Here are my disclosures. I received a speaker fee for this webinar, and I received a stipend from the University of Connecticut through a training grant from the National Institutes of Health. I'm going to share a little bit of information about my background that is relevant to today's topic. I am a former public school teacher turned researcher. From 2011 onward until about 2014 or so, I taught autistic young adults, all of whom were non-speaking or minimally verbal. And in that time, I had a growing interest in trying to better be able to characterize their language abilities. And of course, as a practitioner, I didn't necessarily have those tools. My primary responsibility was to serve these autistic students by teaching them. So in talking over my growing interest in their language abilities with my mentors from education and from academia, I ended up going back to school and I pursued a PhD in child language at the University of Kansas. And after spending about 5 or 6 years there, finally finished my PhD, and I wanted to further expand my skill set. During my doctoral training, I worked on a longitudinal study that took place in the community and looked at language impairment in families where one or more individuals had language difficulties, but others did not. In addition, during my doctoral training, I built out my own community-based research to try and better understand language and context in autistic individuals who came from racially and ethnically minoritized backgrounds. So turning back to my postdoc, that's where I am currently now. And my research is trying to bridge the connections between brain and behavior in this group of individuals, meaning autistic individuals with language impairment. And then in January, as previously noted, I'll start a tenure track position as an assistant professor at San Diego State University. So this is just a little bit about where I'm coming from in my thoughts and approach to thinking about quality language assessment. Here are the learner outcomes for today. After this webinar, hopefully attendees will be able to describe 2 ways in which consideration of diverse identities should guide language assessment, list 3 strategies for being responsive to the identities of diverse school-age children, and apply a unified model of validity to language assessment of diverse school-age children. And here is what is motivating this work. And if any of you can hear a siren in the background, please excuse me. My office is on a busy street. So if we look at guidance from the American Speech Language Hearing Association on cultural and linguistic competence and the Code of Ethics, here is how they refer to thinking about these constructs that feed into diversity. Under culture and linguistics, ASHA states that it refers to human behavior that involves things like language, communications, actions, and beliefs, as well as other dimensions of identity that can include race and ethnicity, religion, as well as gender identity, gender expression, age, and disability. And when you look at the list of all these different constructs that pertain to culture and linguistics, it can seem daunting since no one individual can be an expert in each and every walk of life. But I think what we could focus on as a workable solution is gaining competence and understanding what we know, and importantly, what we don't know, and learning how to use the tools available to us in our practice or at our workplaces to equitably serve all individuals that come onto our caseloads or into our research labs. And here is kind of one of the big ticket questions. Why does language assessment matter? If we think about language acquisition, we can think of language abilities as a thicket. So looking at that circle in the middle of the slide. This is because dimensions of language, like vocabulary or the words I know, do not appear as discrete entities. Rather, others interpret a thicket or a confluence of behaviors that appear together arising from linguistic competency. In the real world, having limited linguistic competency puts individuals at risk in multiple ways. Relative to peers with typical language, research shows that individuals with language impairment are likely to achieve less education, all the while being under-identified in the school system, to obtain jobs of lower status, to report experiencing threats to physical safety, especially if one is female, and to experience bullying in childhood and social isolation in later life. And finally, relative to peers with typical language, individuals with language impairment are likely to report higher levels of social anxiety. So when we think about assessment and trying to adequately characterize processes of language acquisition, any examiner, whether they're a clinician or a researcher, or both a clinician and a researcher, plays a really important role. So again, thinking about duplicative behaviors, let's think about ways we can be responsive in assessment when working with diverse individuals. Looking again at guidance from ASHA, we know that there are some strategies that are effective for diverse school-age children. One of the things we can do is pursue lifelong learning about cultural and linguistic diversity in the discipline of communication sciences and disorders. I know I myself am learning new things every day. For example, ASHA recently came up with guidance in collaboration with LGAS on effective strategies for working with clients and individuals from the LGBT and gender nonconforming community. Examiners can also use assessments that speak to individual differences in profiles. This could mean using multiple measures, collecting information from multiple informants, as well as in multiple languages, especially if an individual speaks multiple variants or types of English, as well as multiple languages themselves. Examiners can also honor individual values, preferences, and language. Here is what this can look like. In my own research, I work with individuals who are all culturally and linguistically diverse. Some of them have caregivers or family members who speak additional languages other than English. So what does this mean? Well, for example, if I'm speaking to a caregiver who feels the most comfortable communicating in Spanish, which is a language I speak, I will speak with them in Spanish and follow the norms that are appropriate. So that might mean I will use the more formal version of you, usted, versus the more familiar tú when I start talking to them. And over time, maybe they'll ask me to use a less formal version of tú, of you or tú, or maybe they won't. But really, it's just showing that I'm making some kind of effort to learn about and to honor their language and culture. Another strategy, and this comes in especially when we think about appreciating what we know and what we don't know, is using referral as needed. So if an examinee comes onto your caseload or into your research lab, and you realize that whatever their language profile is beyond your own skill set, you could refer them to somebody else who might be better suited to meet their needs in terms of language assessment. And last but not least, we should all be thinking about accessible assessment. And this could mean engaging in interprofessional practice and reaching out to qualified and trained interpreters, as well as bilingual practitioners. Just because of the nature of the talk today, I put down SLPs for speech language pathologists, but obviously this could apply to audiologists as well, depending on what type of assessment you're doing. Next, I'm going to turn to talk about how these threads of diversity, language assessment in the big picture, and responsivity feed into how we think about whether or not a test is right for whoever we're working with in assessment. Traditionally, in psychometrics, or theory that pertains to assessment, people talked about different types of validity. And I'm going to give some examples here. One type might be construct validity, and that can mean we think about whether an assessment measures what it says it is measuring. An example would be, does an overall language assessment really measure overall language, or is it also measuring something else, like perhaps cognition? A second type of validity is content validity. And this entails thinking about whether a test truly represents what it aims to measure. And this could mean that if I am coming up with a speech and language assessment protocol, I might think about whether or not it is actually assessing each aspect of speech and language and cultural and linguistic diversity in terms of thinking about whether or not outcomes and content will be meaningful to examinees of diverse backgrounds. And a third type of validity is criterion validity. This means thinking about whether results on an assessment reflect the outcome they ought to measure. For example, if a speech language pathologist makes a new task to measure the language skills of bilinguals in Spanish and English, they might compare their outcomes on this new measure to a prior test that has been previously validated for this population. And so instead of thinking of these separate kind of types of validity, there's been kind of a movement, at least in psychometrics, in thinking about a unified model of validity that I find really compelling for thinking about fair and equitable assessment of diverse school-age children. So here we have something called a unified model of validity. Instead of thinking about those separate validity types, construct, content, criterion, and more, we could think about validity as an integrated judgment of the degree to which evidence and theory cumulatively support the interpretation and use of test scores. I know this can seem a little bit abstract. I'm going to show you a slide on the next page that sort of illustrates how I envision this in an assessment process. But first, in brief, we could think about the meaning of scores under this unified model of validity. We could think about the importance of the scores from language assessments as a basis for action to meet the needs of diverse school-age children. And this really entails pivoting from thinking about separate types of validity into thinking about the functional impact of scores in terms of social consequences of their use. So here is the model that kind of brings this all together. As you can see under step A1, as an examiner, one might look at not just the assessment outcome or the performance on one assessment, but also think about the context or an environment in which assessment takes place. And in interpreting that assessment performance and the context, an examiner might also think of an individual's identity and all the intersecting variables that make up who they are and how that might influence assessment performance. In addition, an examiner might look at validity evidence in order to come up with what they think are valid assessment interpretations. So looking at the box on the bottom, this could mean thinking about those different types of validity as kind of overlaying with one another and looking up information in something like a test manual or in previous publications in the research literature or other resources that have this information. So altogether, it's not just assessment performance in a specific context, but also consideration of individual identity and other validity evidence that should inform interpretation of an individual's language ability, or as you can see under step B1. And ideally, examiners are bringing together multiple pieces of evidence and doing the same process. So if you look down at steps A2 and B2, so ideally, examiners are bringing together these multiple pieces of evidence and interpretation to make valid conclusions about language ability, as you can see in step 3. And again, it's important at each and every step to proactively think about individual identity and how that could influence test performance, as well as our own identities and our positionality, and maybe how that influences how we perceive test performance. And then finally in step D, hopefully that will lead us to using assessment outcomes to make valid decisions and good decisions for diverse school-age individuals. On the next couple slides, I'm going to show you some examples of one way in which examiners might think about validity evidence for assessment interpretations. So this is a paper that came out in Perspectives in 2022. And on this table here, you see an overview of some language assessments for school-age children. And in the left-hand column, you see the abbreviation of these various age-referenced language assessments. In the second leftmost column, you see the ages for which these assessments are normed. So you could think about that in terms of thinking about was this test designed for individuals I am working with? You could also think about the language domains that these tests assess. Another common metric that people look for is R, which stands for reliability. And I know that there's various guidance out there on what the minimum reliability is needed in order to make educational decisions or clinical decisions for individuals. What I want to focus on is the norming sample. And this includes N, indicating the size of the norming sample, ages, meaning ages included in the norming sample, and the US Census year. And that refers to the US data from the US Census that was used to develop test norming samples, which were broadly representative of the US population at that time. So when we look at N under norming sample, examiners might think about whether or not the sample size is sufficiently big enough to kind of detect variability in the examinees who might be diverse and like the ones that they serve in everyday practice or research. If you look at ages, again, you might think about whether or not participants in those norming samples represent individuals like the ones you are tasked with administering assessments to. And under US assessment year, well, if anyone here has followed some of the US Census updates for 2020, we know that demographic changes have been pretty significant over time. So you might take a moment and think about whether or not the US Census year for the norming sample is representative of diverse school-age children like the ones you work with. And in the rightmost column, we have one or more variants. And what this column refers to is whether or not some of these test manuals speak about individuals who speak General American English, as well as other variants of English. This could include African American English, or you might also find it under the term dialectal variation in test norming manuals. And these are just a few of the things that you might think about when you're reading through a test manual in terms of external validity evidence. In addition, if we're working with individuals who come from clinical populations who are also diverse, you can also look in test manuals to see if they carry out clinical validity studies. And again, here are those same assessments from the previous slide. And I'll read off the names of some of the special populations one might expect to see if reading through a test assessment, an assessment manual. You might expect to see autism spectrum disorder, hearing impairment, language disorder, intellectual disability, specific learning disorder or disability, speech sound disorder, social pragmatic communication disorder, developmental delay, and other health impairment. Next, we're going to move into a couple case studies to provide a brief walkthrough of how this approach can come together in actual assessment practice. Here's one case study. An examinee is 15 years old with a diagnosis of autism. Their nonverbal IQ is below 70. When a speech-language pathologist administers the SELF-5 at school, their core language score is 40, their receptive language score is 50, and their expressive language score is 45. Throughout assessment, the examinee is engaged and talks about their interest in doing laundry toward the end of assessment. They mostly speak in full sentences, some of which have 2 or more phrases. After clothes come out of the wash, you have to put them in the dryer low heat. In addition, the examinee takes part in multiple conversational turns when the examiner probes for more information. The examiner learns that the examinee comes from a close-knit African-American family with a strong sense of cultural identity. I want to highlight some things here. So first, if we look at their profile of self-scores, we might expect, oh wow, they really have significant language difficulties. Their scores are near or at floor. So that's just kind of one piece of evidence. I also want to highlight that in terms of kind of back and forth interactions, this examinee is producing full sentences, and some of them have complex syntax or 2 or more phrases in them. So that's just something else to note that might seem to contrast the self-5 scores. And furthermore, they're taking part in multiple conversational turns. And that's important to just track because the core criteria of autism spectrum disorder include a social communication impairment. So if we're trying to put this onto the approach or the figure that I showed you before, here is how we could think about it. So performance at assessment 1, that's the self-5. And this assessment took place in school with a speech language pathologist. We don't know how familiar the examinee is with the practitioner who gave them the assessment. We just know it took place in school and they had scores that were well below age expectations. We might think about individual identity variables if we're trying to interpret the scores on the self-5. And again, those are the variables over here in this green box. And what do we know from the case study? We know they're African-American, that they're also male, that they really enjoy doing laundry, and that they have a strong sense of cultural identity. And we don't quite know from the case study exactly what this cultural identity is, but that could be an area where one might probe for more information from other professionals or from family. And in terms of validity evidence for assessment interpretations, you might go to the self manual to see what information is there that fits the profile of the examinee from this case study. If we're thinking about a second piece of evidence, well, we might think about the spontaneous language that the examinee produced when talking about their interest in doing laundry. And again, in thinking about validity evidence, we might go to the test manual and think about the different boxes that this examinee might be in, or the different clinical validity studies. This could mean looking at the autism validity study, or some of the other evidence that is there for individuals with intellectual disability, since their nonverbal IQ is below 70, and possibly learning disability. And ideally, considering both self-5 performance and some of the spontaneous language, as well as the validity evidence and identity variables, hopefully that will lead examiners to making valid conclusions about their language ability. One conclusion could be that perhaps the validity evidence didn't match the examinee in looking at the self-5 manual. And maybe that is justification to probe further for more information or to provide additional information. And ultimately, hopefully that will inform better use of assessment performance. And here are some of the conclusions. Again, when interpreting assessment performance from diverse examinees, one might think about intersectional representation in the manuals. And then following manual guidance, and I know this is common across all different types of age reference assessments, from the ADOS to things like the SELF, one might think about breaking standardization, especially if you realize an examinee is not necessarily represented in test norming. This could mean using things like conceptual scoring or alternative scoring methods to best understand how examinees use language when they speak multiple variants of one language or multiple languages. And importantly, you have to think about how to explain this in reports, whether it's a research report, an IEP, or other some sort of research justification. And indeed, if we look at the Self-5 manual, when we look at these clinical validity studies in which the hypothetical kind of person from the case study could be in, we should be looking at autism, language disorder, learning disability, and potentially intellectual disability. And for example, in reading through the Self-5 manual, one might note that the language disorder group included in individuals who could be bilingual for ages 9 to 21. One might also note that the language disorder sample included about 2% of Asians, about 70% of African American examinees, about 27% of Hispanic or Latinx examinees, about 46% of white examinees, and about 8% of other racial and ethnic groups. And depending on who you're working with, maybe that provides additional evidence for or against the use of an assessment as is. And now pivoting back to thinking about the big picture, which is how we are going to interpret and use age reference assessment measures. You could think about whether or not it's clear if an examinee like the one you're working with was represented in the norming sample. You could also think about discrepancies between different pieces of evidence, which were in this case, informal and formal assessment. And ultimately, this should inform assessment performance use. And this could include using scores and interpretations of assessment performance to argue for or against eligibility for speech language services, postgraduate, but I think what I meant to write is post-secondary programming, or even in some cases, things like legal guardianship. Okay, so we'll move on to a second case study, and I'll try to go through this one pretty quickly to leave more time for discussion. A student enrolls in kindergarten in the US when the family immigrated from Guatemala. Their parents speak Cahoua, which is a Mayan language, but mostly speak in Spanish with their children in the US. The student understands some Cahoua, but does not speak it. The classroom teacher refers the student for special education testing as the student has not been heard to speak at school. Classroom instruction is in English. Language assessment results in Spanish show standardized scores in the 70s, indicating speech and language impairment. The SLP observes that the student is conversational in Spanish and seems to have a good grasp of language. The student shows age-appropriate language skills using a task item analysis and dynamic assessment on items marked wrong to determine language learning ability. Okay, so first, the student understands Cahoua but does not speak it. And in many bilingual learners, they may speak multiple languages and have varying proficiency or competency in different languages. And importantly, if you're thinking about comparing them to monolingual speakers, that is not a best practice. So that's just one piece of evidence. Another one is that the student has not been heard to speak at school. They are a bilingual speaker in Cahoua and Spanish, picking up an additional language, which is in this case, English. So they are a multilingual speaker. And even though much of the world is multilingual, oftentimes in perhaps clinical training or academic and research training, less attention in research is necessarily on multilingual speakers. The third piece of evidence is that this student has standardized scores in the 70s, which would indicate a language disorder if following test manual norms. And then last but not least, when the SLP breaks standardization and looks at the items that the student had an incorrect response on, and they went back and taught those skills, the student showed age-appropriate language skills. And this slide sums up those considerations, which is first, the student is a multilingual speaker, picking up a third language in addition to their first two languages. And so it's really important to think about disorder versus difference and which norms to use. And personally, I wouldn't be sure of which norms to use, but I wouldn't necessarily sit and compare them to monolingual norms, thinking about the rich language background that this student brings with them into the classroom. The second consideration is breaking standardization. And typically this is something that test manuals also address and instruct examinees to do if they feel that an assessment is not a good fit if administered as is to an examinee. And again, this could include things like dynamic assessment, as well as on the back end, making sure that you justify the scoring methods that you are using in reports, IEPs, or other documentation. And for the sake of time today, I'll go over this part very briefly. So here we think about performance on those standardized tests in Spanish, where they have scores in the 70s. The context is that it took place in a relatively new school where classroom instruction is in English or in the student's third language. The identity variables might include thinking about things like the fact that the student is an immigrant who moved here from Guatemala, that they are trilingual, that they are a heritage speaker, and that they bring in a specific cultural background that may or may not be like the other students and individuals in their everyday school environment. If we think about a second piece of assessment evidence, or actually validity evidence, we could again go to the test manual to see if anyone in the norming sample is like this examinee. A second piece of evidence comes in when the SLP broke standardization and conducted dynamic assessment. And again, ideally the examiner is thinking about individual identity and validity evidence. And based on the standardized Spanish test scores, they might check the clinical validity studies for autism and learning disorder, language disorder, intellectual disability, and learning disability. And ideally, they're bringing these multiple pieces of evidence and interpretation iteratively together to make valid conclusions about their language ability and needs. And again, considering their identity at this step along the way before making decisions about their language needs and profile. As with the last case study, this just sums up the possible interpretation and use of these test scores and pieces of assessment evidence. So one might think about whether scores reflect learners like this student in this case study. And this could be indicative of whether or not there's variation in informal and formal assessment scores that come from the test norming sample. And in this case, considering that this hypothetical examinee is much younger, some potential uses could be qualifying them for services and thinking about whether or not they're going to advance to subsequent grades, especially because they are in elementary school. And even further, in thinking about this student's rich background, an examiner might think about other ways of getting additional pieces of evidence if they are unsure about how to interpret variation in assessment performance and different pieces of evidence. This could mean reaching out to the family, to the classroom teacher, or other professionals in the school setting. And now I'll share just some brief concluding thoughts before we hopefully have time for a Q&A. So overall, oftentimes people are trained to think about multiple types of validity, both in clinical practice, education, or in research. And under this model, this treats pieces of validity evidence as totally separate. Instead, especially if we're thinking about interpretation and use, we want to think about building a cumulative evidence trail that integrates evidence in an iterative fashion. So this could mean thinking about testing and test norms, parent report or reports from other education professionals. And this could include information on cultural and linguistic diversity that is relevant to interpreting assessment performance. And then last but not least, this could also include things like interprofessional practice to fill in some of those gaps. And again, this is the big picture of where I think we want to go if we're trying to figure out how to implement efficacious assessment strategies for diverse individuals. And on this page here, I don't think, I can make this available to anyone who's interested, but this is just like a tool that I came up with using handy dandy Microsoft Word to go through some of these steps to be able to actually sit and write out responses to each of the prompts from the model on the previous slide, since I know that can seem overwhelming and kind of daunting. And that is the end of my talk. I'd be happy to take any questions. And if not, I have discussion points or prompts, and I'm also just happy to follow whatever guidance from Pearson.
Dr. Girolamo, there was some questions regarding slide 15. I think there was clarification needed on that slide. So if you could just go over that one more time for our participants, I hope we can clarify.
Sure. So in this slide, it's really just showing the different types of validity studies that are done with clinical populations. And in my experience, sometimes it can be a little bit tricky reading the assessment manuals, but at least in overviewing these different assessments, they reported doing special like mini norming studies to look at differences in assessment performance between individuals from clinical populations versus not. So in this case, we looked at autism, hearing impairment, language disorders, intellectual disability, specific learning disability, speech sound disorder, social pragmatic communication disorder, developmental delay, and other health impairment. Are there more, what is, I'm sure there's a more specific question that I'm just not answering. Do you have more information on what someone was asking?
Sorry, I couldn't get to my unmute button. I don't see any questions popping up, so hopefully we did answer that. I see a lot of questions regarding the tool that you posted, and that's available in the handouts. So we'll provide the link to the handouts where they can access that.
Okay, and I'm also, I don't know how your collecting information, but if people fill out the form, I would also be happy to send this to you in a Microsoft Word format in case that's helpful.
Is there an email address where they can email you for that, or?
Yeah, I can put my email in the chat if that is, here we go.
Teresa.girolamo@uconn.edu. Thank you.
Yes.
Let me look through very quickly to see if there are any questions. Okay. I see a question that says, can you use the scaled score on the pragmatic profile for culturally and linguistically diverse families? Although it is not a direct child assessment, the parent reporting may be influenced by their own background.
So they have to be talking about the self. Do I have that right?
We can assume that.
Okay.
They don't mention.
Okay, yeah, no, that's fair. So I use the self-5 in my research, and I have looked, and I also use other parent report members, parent report measures. And my interpretation of parent report measures is that parents are an extremely rich source of information, but we also want to make sure we're collecting other sources of information. And I can talk a little bit about why I think this is. So when I was a teacher of diverse autistic adolescents and young adults who are minimally verbal in the public school system, I would often see, I guess, differences in the use of language skills from what I observed at school and what caregivers and family members told me was going on at home. And do I think either one of us was wrong? No. I think that we can think about the different contexts or environments in which people use language or show different competencies. And especially, I guess, if we're working in clinical or education settings, we were probably working with individuals for a very, very small part of their lives. So in my head, collecting information from parents and then also trying to triangulate that with evidence from other environments and other informants is really informative. So I wouldn't necessarily discount or think about not using parent report measures like the self-pragmatic skill, but I would think about all the additional pieces of evidence that could help us reach a full illustration of this individual's abilities and needs.
Thanks, Dr. Girolamo. I also just wanted to add on the self-pragmatics profile. Since it now has standard scores, it is not meant to be handed to a parent to complete individually. It's meant to be set up as an interview with the parent so that if they indeed didn't understand the question, or what we often see is that a parent kind of answers a different question sometimes when they weren't really quite sure about that behavior. And so if you want to use standard scores on the pragmatics profile on self-5, you need to conduct that as an interview with the parent rather than handing it off to them. And that helps. In addition to having the option, as you say, that there are other parent reports out there that you might find give you more useful information with specific populations. So just wanted to clarify that part of it as well. There's another question, if I didn't even see the time yet. Let's see. We have some time. How do you consider the impact on the validity of test scores by language ability of the examiner and/or the influence of the test administration and results by use of the language abilities of the interpreters? Yes, we had seen you had asked earlier, but we're scanning through the questions as we go. So let's go back to, I know by the time we got to the end of the question, but considering the impact of test scores depending on the language ability of the examiner and the influence of test results, given the language abilities of the interpreters.
So this is oh, sorry, did you want me to answer? I heard like a pause on my end. I don't know if I'm supposed to answer or somebody else's.
Oh, no, go ahead.
Okay. So what's interesting to me is reading the guidance from ASHA on this, and I'm sure there's additional guidance coming from Pearson and other, assessment developers who write these manuals. And what I see is an emphasis on finding trained interpreters. And I can't speak to the linguistic competency of an examiner, and perhaps I'm totally off here, but my assumption would be that an examiner giving an assessment is ideally coming in with the training to administer the assessment in a way that will yield reliable and consistent results if another examiner was going to give that same assessment. I'm not saying this happens, but that is, at least in theory, what should happen. Moving on to interpreters, what I see is guidance from ASHA highlighting the importance that people are trained, and they're not just any person who happens to be bilingual or multilingual or familiar with the culture and a language. And I know that interpreting is a skill in and of itself. I've heard of medical interpreting programs for folks in Spanish and English as well. And I can imagine there being other similar programs. I remember as a teacher who was not doing language assessments, one time people had someone who was bilingual come in and try to interpret for a parent meeting. And I could tell that what was happening was the interpreter was wonderful and fluent, but not trained. So what they were telling the parent in Spanish was not what I was saying in English. And this was before I told anyone, I think, that I also spoke Spanish. So I can really see the breakdown between what happens, I guess, in theory, and what happens if we don't think about kind of finding qualified professionals, just like SLPs, at each step of the way in the assessment process.
We have another question. There was a recent op-ed in the New York Times entitled "The Language Test That Stigmatizes Black Children." It was about the self. Did you see this, and how do you respond to their critique?
So I did read that. And I know that there was the one line that said like 10 items from one of the specific subtests was biased against speakers of African American English. And for me, what it comes down to is do not ask a test to do something it was not designed to do. And for me, what that means is you should not be asking a test to replace the expert clinical judgment of a speech language pathologist, or in my case, of a language researcher. You should know the people you're working with best, and hopefully that includes information about their language profiles, about their identities, specifically in thinking about the language communities in which they might be a member. So in my case, I work with Black or African American, because not all Black people are African American individuals. And I also work with Hispanic or Latinx individuals. So I know that, at least for me, when I look at self data, I don't necessarily just give the self and think, great, I'm going to call it a day. On my own, I look at some of the guidance talking about people who speak multiple variants of English or who are bi or multilingual. And I also look at the errors that the people I work with make, because when I talk to individuals who are language scientists in variants of English, like African American English, I have a better idea of understanding what errors might be indicative of membership in a language community, even though maybe I'm not picking up on other measures. So really, I think it comes down to not asking a test to do something it wasn't designed to do. And if you do have to use a test, but maybe you realize it isn't the best fit for whoever you're giving an assessment to, being able to cite your evidence of why it is not an appropriate use of a test score for that individual. I think that's what it comes down to.
It looks like we still have time for another question. How would you approach employers or entities that do not utilize trained interpreters or certified bilingual therapists for assessing multilingual individuals?
Oh gosh, yeah. So this is a hard question. And the last thing I ever want to do is come off as dismissive of the everyday challenges that I know practitioners, especially in school-based settings, can face. So putting my teacher hat on, or I guess my school-based practitioner hat on, I would think about how to advocate for the services, which could include things like having bilingual interpreters that students need. And I also understand that practitioners have to protect themselves, especially if they are in states where they have things like tenure and you're pre-tenure in a school system. One thing you could do is see if you can find other allies, particularly who are more senior than you, who could help you advocate for bi or multilingual interpreters. I've also heard of other people referencing whatever the legal statutes are for their local, for their state. And I know oftentimes some of the policies under IDEA look really different from local education agency to local education agency. In my own personal experience, what I did, but I wouldn't necessarily recommend this to anybody else, is I got to know the parents of my students really well. And I got to know which parents I should contact if I needed to advocate for a specific resource or service to meet the students' needs. And I found that strategy to be helpful for me. But again, I also recognize that practitioners in school settings are often put between a rock and a hard place. So of course, finding these services may not be as simple as what I'm saying here.
Thank you. Do you have good resources for learning more on African American English to prevent misinterpretation of academic achievement measures like the Wyatt 4?
Yes, so I can't speak specifically about the Wyatt 4, and I don't want to tell anyone go read all these resources online because I know that everyone is very busy. But if you would like, I can put some names in the chat of people who are doing research in this area, meaning they're doing research on language acquisition and use in African American English. And some of this even includes thinking about geographic variation in the use of African American English. I'll put their names in the chat right now.
And for those of you looking for the email of the presenter, it should be in the chat.
Yeah, so some of the names that I can think of off the top of my head are, okay, one more, sorry. Jana Edding, who is at Louisiana State, Julie Washington, Ryan Lee James, and Brandy Newkirk Turner.
We have 1 minute if you'd like to wrap up.
I don't have anything else, but just thank you for this opportunity. I like talking about assessment because I think it's an ever evolving topic. And at least for myself in my own training, I didn't necessarily learn about psychometrics unless I went out of my way to learn about and read about psychometrics.
Well, thank you very much for doing this presentation. It's been excellent, and I'm sure that the people online got a lot of great information from it. And you had so much time for questions, so that was wonderful. Hope everyone has a great afternoon. And it looks like we're still live. If you have any additional questions, you can email clinicaltraining@pearson.com.